Welcome to this episode of Mindful Medicine. I'm your host, Tracie Jones, and we're here with Dr. Jim Schrenker. Today, we want to talk about the human side of ourselves. Dr. Schrenker, could you tell us a little bit about the human side of all of us?
Well, without a risk of being very simplistic, it is about being human. We talked about it in the previous episode about how we are spiritual beings having a human experience, but getting back into the human part of it, there's four things that we talk about here. We call them the four pillars. One is loving people as wholly and as unconditionally as you can, eating as clean a diet as possible, exercising your mind and your body, and then fourth is having a purpose when you wake up in the morning. A lot of people, as they get older or retire, fail to have a purpose, and then they just kind of sputter, and that is a death nail. The purpose doesn't have to be whatever your job was. The purpose could be taking care of your pet, taking care of your grandkids. The purpose could be, providing for a neighbor. It just has to be a purpose. That's probably one of the most overlooked things as people retire. They have all these hobbies they want to do, but doing a hobby isn't necessarily a purpose. And I think purpose I would think implies interactions with another human being or something towards somebody else. Diet. We have a whole chapter in the book. There's volumes written on diet. We're not going to get in carnivore versus Mediterranean versus vegan or vegetarian. Diet is whole food, eating food without ingredient labels, eating foods without preservatives, eating foods without dyes and colorings, eating what grows out of the earth or grows on the earth. I think if you just did that, that would take care of 80% of any question anybody could have about your diet. Whether it has red meat, pork, and dairy in it, or whether it's vegetarian or vegan. Exercising your mind and your body. Exercise changes over the course of a lifetime. Sometimes just getting up out of bed and walking around the house is as much as you could muster. But you got to move. You got to move your joints. You need to exercise as much as your body allows you and as often as your body allows you, because the more we move, the better off we are. The reason 20 years ago a hip fracture carried a 25% mortality rate isn't because of the hip fracture. It's because they were in bed and they never walked again. So simply getting up and moving will prevent most of the issues with orthopedics and with stagnant blood. And then you got to exercise your mind. You got to expand your mind. You got to read things. You got to challenge yourself. You got to expand what you know and push yourself to limits of things that you may not believe or you may not understand. And that's just being inquisitive and being curious. And I think we all can state that if you wake up and you have a purpose and you're eating a pretty clean diet and you're moving around and you stay curious, that's a pretty good formula for living a great life. So those are really the four pillars.
And I guess it is kind of hard, like you said, when you do retire. Mm-hmm. And a lot of people have probably put their self-worth in what they do, their
right.
career. So finding a different purpose like a hobby
right.
is very different for them. So something that you've mentioned before to me is something called willing service.
Right.
So does that kind of play into this a little bit as far as a purpose for someone?
Absolutely. Willing service is something that every person at a certain age should try to cultivate. For me, it's what makes us human. It's the highest calling of a human being. Willing service is trying to carry out Prime Creator's directive of unconditional love. How can I be a source of that love during the day? What you may not understand is you don't have to go into the priesthood or the clergy to do it. You need to do your job, whatever that job is. you need to enjoy what you do. But if you're a checkout person at Walmart, you're meeting more people than most people meet in a day. What are you bringing to them? Not everybody's going to be in a good mood, but that's not your problem. But you can smile and you can greet and you can be happy and you can spread that. That's willing service. It doesn't have to be feeding the homeless. It can be anything you do, whether it's a fishing guide, whether it's a garbage collector. Are you doing what you do with pride, with joy, with love in your heart? And are you interacting with your workers and the clients you come into contact with in a happy, holistic way? That is the pinnacle of humanness as far as I can see.
And I guess that rubs off on other people. So
Yeah,
if you smile
absolutely.
at someone, they're going to smile back
Right.
most of the time.
Right.
If you are angry and you're like, I've been having a horrible day, and then it's going to rub off on that
Right.
person, and then it's could potentially change their attitude and the way they feel
Right.
for the day, and then it just keeps spiraling.
Right.
So you can go positively or negatively,
Right.
I assume.
I mean, if anybody spent any time around me and, how are you doing? I always say fabulous. I'm fabulous. I've never been better. The days that I'm not fabulous and the days that I have been better, at least I'm talking myself into it. I'm not going, So, but the response I get is interesting. It's like, oh, really? That's really good. They don't expect it. Yeah, I'm doing all right. So just in that one word, just in that conveyance of a smile, some eye contact, a firm handshake, you're conveying so much. And that's who we are as human beings. You want to kill a human, isolate them. You got to have human contact. You got to have that interaction, and that interaction needs to be as positive as it can be at any moment.
Well, that makes complete sense, and I can see how that would also help your health.
Yeah.
Because you start focusing on, man, maybe it's not such a bad day.
Right.
Or,
Right.
and look on more positive things.
Right.
Right. So when somebody comes into your office and they're like down in the dumps and you come in, I'm fabulous. By the time they leave, do you see a difference in how they're carrying themselves and how they're talking?
Yeah, almost all the time you would see that. But also during that office visit, you're never being demeaning. You're never putting anybody down. You're never being judgmental outside of the frame of going over blood work and explaining things. Always leave hope. Hope's always there. They can always get better. I mean, the only thing that's preventing you from having a good day is you. I mean, if you look at it, it seems really simple, although that is pretty hard for some people to do, to put their illness behind them or their relationships behind them and move on in a positive, loving way.
Well, on that note, I'm going to ask you, because I love to challenge you and put you on the spot.
Great.
So how would you challenge people to take that next step?
So willing service?
Yep.
Simple. The next person that you come into contact with, smile and truly want to be there with them. If they ask how you're doing, give them a resounding positive feedback. And if you're somebody that usually complains to your friends and you do that, you will get their attention. But if you just simply respond with, I'm doing great, and if you don't want to do that, I'm doing better. I'm better today. Then it'll just keep getting better. So that's what I would do. Is simple, easy. I mean, you can do it within the next 15 minutes of your life.
Great. Well, thank you so much. And thank you for watching this episode of Mindful Medicine. And remember, you are loved.